Assalamu alaikum and Trust Kind Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right 7, which has been highlighted for a fracture. On the panoramic view, we don't see anything major except there is a radiolucency. A J-shaped radiolucency can be seen in the lower right 7, lower right 6. When we look at the lower right 6 and try to evaluate for a fracture on the transaxial view, we can see many things very clearly. So this is the lower right 6. Here you can see that there is a fracture line extending from the occlusal surface into the chamber, and as we move on to different slices, this is the distal portion of the tooth, and you can see very clearly that it is associated here. As we move on, we can see on this line that this is a fracture line extending from the occlusal surface to the inside of the chamber. We see a periapical radiolucency here as well, and this is something that is of note in the lower right 6. The fracture line can be seen here as well, as you can see extending from the occlusal surface into the chamber space, and the crack is very clearly visible at this thin slices. When we look at the tooth from an axial point of view, we can also see quite a few areas of where the crack is visible. This is the lower right 6 region, and here you can see that the fracture line is also extending here, and it is very clearly visible on this segment right here. So the fracture is definitely extending, and you can also see a radiolucency right here, which is significant of a fracture line extending into the crestal bone regions. So this tooth is definitely showing signs of fracture. This is the lower right 6 that is showing signs of fracture. The lower right 7, however, we cannot see any fracture line here. You can see this is the mesial root. The mesial root shows no fracture line. This has a canal configuration of very significant. This is what two mesial canals, the mesiobuccal and the mesiolingual, which end at one apex. And then we've got the distal root, which has one single wide canal ending in one apex. So we don't see any fractures or cracks in the lower right 7. However, in the lower right 6, we can definitely see quite significant fractures, which we will show you on this view again for the doctor to understand that this is where the crack line extends into the pulp chamber. Here it's quite visible, and you can also see a little bit of radiolucency extending into the interradicular area, and the fracture line can be visualized here as well. So if you have any further questions regarding this case, please feel free to reach to our team. Thank you very much. We'll also show you the upper right central incisor. The upper right central incisor is right here. We don't see anything problematic with the upper right central incisor. There's no radiolucency. This is the incisive foramen. Nothing significant of note, no periapical radiolucency or no J-shaped radiolucency. The upper left lateral incisor is also an area of interest. We cannot see anything problematic with the upper right lateral incisor. No crack lines can be seen, and no radiolucencies can be observed in this tooth as well. Thank you very much.